Hi, I am Dr. 𝗘𝗂𝗶𝗃𝗃, root canal specialist. Today's topic is non-carious lesions. What does that mean? We all have the perspective that any problem in our tooth is because of dental decay. But my topic for today is non-carious lesion, meaning to say there are even some other reasons because of which the teeth can get affected. It's not just dental decay. I do agree that the most prevalent cause for damage to the teeth is dental decay. I do agree, but there are certain other factors also can cause damage to the teeth. So what are they? There are three factors or causative process through which our teeth can get damaged without having any dental decay. So let me tell one by one. First is attrition. So the term attrition means it's just one tooth and another tooth coming in contact, and when they rub against each other, the wear that occurs. There is something called physiological attrition and pathological attrition. Physiological means normal. So what is physiological attrition? Let's assume my permanent tooth comes when I'm around 6 years old, and now my age is 60. So this tooth has survived in my mouth for around 50 to 60 years. That's a good job, but just imagine the wear and tear, or how it would have thrived in that oral environment, how many things it would have faced during the course of its life. So because of this, there's definitely going to be some wear and tear which will occur on those teeth which are considered normal. And the good thing is that your teeth's defense system can easily manage it. They can repair it. This is the case with physiological attrition, which is a normal wear that occurs on the tooth during the course of our life. But when you move on to pathological attrition, pathology means a disease. So this is something beyond the control of the normal process, and your tooth's own defense system cannot manage it. It's too much for it. So this pathological attrition, how does it take place? It's because of continuous tooth grinding, which we call parafunctional habit, or in medical terms we call them bruxism. You could have noticed even yourself, unintentionally, you might just be grinding on your teeth. You might not be eating that time. Of course, you need to grind your teeth when you eat something, but this is when you're doing some work or something else, or even during your sleep, during your night time, you might be grinding and you might not be aware. Your partner might tell that you are grinding on your teeth, or you'll be able to find when you get up in the morning, you'll have pain here on the cheek because all throughout the night, the muscles were working, the teeth was grinding. It got exhausted, so you have that pain here. But why does this bruxism or so-called tooth grinding occur? One word, it's because of stress. So then this stress, it's interesting to know, even from the school-going children till the age, this stress is a problem. So eventually all of them start to grind their teeth. So what happens? The tooth gets worn out in a way that there's nothing remaining. If you had seen the normal back teeth, there are some inclines, the shape is in a way. But after it gets worn out, it's just flat. And look at the front teeth, they also have a particular structure, an anatomy or a design. All of them are gone when the tooth gets worn out. Okay, this is just about the appearance. As I said, enamel is the outer layer. No problem. But when it goes to the next layer, dentin, it causes sensitivity. When you drink on something cold, like ice creams or cold water, or sometimes even to cold breeze, there is sensitivity. When it goes far beyond this, it goes and hits the nerve of the tooth. That's when you get pain. Remember, This is not because of dental decay, but sensitivity, pain, everything has been caused by this non-carious lesion called attrition, tooth wear. Because of bruxism, teeth grinding, because of stress. So this is the first tooth wear, non-carious lesion which I wanted to describe about. The next thing would be something called abrasion. So abrasion means here something external comes, not just the teeth. This perhaps I would say 50 to 60% of us would be doing, but we are unaware of it. Overzealous toothbrushing, over-aggressive toothbrushing. We have a thought that if I brush for 10 minutes, my teeth gets cleaned. I want my teeth to be white, bright, so I need to brush hard. Not at all. You wanted to do good to your teeth, but what happened? You have caused some bad. Now the tooth has got something called abrasion. It's a defect. If you look at the gum line of the tooth, there is a notch, there is a depression, there is a concavity. That's a defect. Again, not because of dental decay. It's because of your overzealous toothbrushing. So, this abrasion also can result in sensitivity. If it goes deep, it can even cause toothache. That's bad, right? And the next tooth wear, which I will be talking about, is erosion. So here comes something called acid exposure. So I would like to divide this erosion into two. Extrinsic, which is from the outside, and intrinsic, which is from the inside. Let me talk about the intrinsic first. What is this intrinsic erosion, or the one that comes from inside? It's because of something which we call GERD, gastric reflux. So you know that the stomach acids are so acidic that when some people have the reflux problem and it comes out, they can erode the inner surfaces of the teeth, again resulting in sensitivity and toothache. Eventually they might even lose out their tooth. Or some people might have repeated vomiting episodes. This can also cause the same acid attack. Remember, this acid is not caused by the sugars or by the bacteria in your mouth, not dental decay. It's from gastric acid, the acid from the stomach. So this is intrinsic erosion. What about the extrinsic one, the one from outside? It's because of we drinking a lot of carbonated drinks like Pepsi, Coke and things. Even with excessive amount of drinking lime juice because it has citric acid in it. Even this can cause extrinsic erosion or erosion from outside. You can just have them maybe once or twice or in a while, that's okay, but too much of consumption of this can also erode your front surfaces because it's from the outside. So all these tooth wear can happen and cause the same consequences as dental decay, but still they are not dental decay. Okay, now how can we manage them? So first, for attrition, I told you it was because of stress. So I would suggest you try some stress reduction protocols. You can go for a counseling therapy if you have any problems to a psychologist or a psychiatrist, get it addressed, or you can do some meditation and things and get rid of the stress. Take your family for an outing, go for a holiday, spend some time with them, your stress is reduced. But what for the teeth, which have already been worn out? There is something which we give, which is called a splint, a night guard. So when you wear them when you go to bed, even when you grind, you don't grind on your teeth. There is something in between, that is our splint. So you just grind on the splint and not on the teeth, so your teeth are protected. So this way we can handle attrition. And if there is any tooth defect, it can be also filled. We can give a filling and restore them. Moving on to abrasion, the one because of the overzealous toothbrushing. Be very careful not to use hard bristled brushes. They're not meant for you. They're meant for the people with limited dexterity. Rather, I would suggest you go with the soft or extra soft toothbrush. And don't use any abrasives like raw charcoal powder to brush your teeth. Use normal toothpaste. So, you can avoid this abrasion. Please brush only for 2 minutes. Twice a day good, but not more than 2 minutes. And also, I advise you to change your brush once in 2 months. Just check for it if the bristles are worn out. Then it's of no more use to brush your teeth. This way we can handle abrasion. And if there are any defects which are already caused because of abrasion, as I said before, they can be filled. And the final thing is erosion. If it's from the outside, you already have the answer. You can control the amount of soda, the carbonated drinks that you consume, or the lemon juice that you take. Reduce them. If not nil, at least reduce the frequency, reduce the quantity. But if it's from the inside, you definitely need to go and consult a gastroenterologist who will be able to tell you as to how to correct this. If it's a reflux disease, he would give you medications or some treatment for that. Or even if it's a vomiting episode, he can help you with that. So this way we can handle erosion. And if there is any tooth related problems because of erosion, tooth destruction, we can definitely handle them by doing a filling, or if it's too much, we can even handle by doing a root canal and giving a crown. Even if because of attrition or abrasion or erosion, any of these three tooth wears which I discussed, any problem which has gone out of hand, the tooth is now is just a little of tooth remaining, no worries. We can always do a full mouth rehabilitation. We can give crowns on all the teeth and we can still re-establish the lost function of your teeth. It's still doable. That's the good news. So I would like to end this topic by just telling a quote. Smile is very important. Speech is very important. And to eat well is also important. For this, there are definitely more problems other than dental decay or cavities which can cause this. Be informed about that. So to get a functional and a disease-free smile means looking far beyond cavities. And also, it is required to understand that how our teeth interact mechanically, physically, and chemically every day. Having spoken so much about what we will be doing at the dental clinic, I would also like to add on what can be done at home. So, if these tooth wear are at the initial stages, what we can do is we can just prescribe you a desensitizing toothpaste. Not the regular ones we use. These are specific ones, special ones. They are formulated for desensitization, so which we prescribe. When you get them and use it, I will also teach you how to use it. So, you just take a little amount of toothpaste on the toothbrush. Just apply it on all the surfaces of the tooth, or if there are any only specific teeth that are sensitive, just apply it on them. Leave it for around 1 to 2 minutes. Don't start brushing. So, by this, you can allow the sensitive desensitizing toothpaste to work on the sensitive teeth and give its effect. After 1 to 2 minutes, you can brush gently and then you can leave it. So, this is how you can use a desensitizing toothpaste. But one thing which you must remember about erosion is, once the erosion episode occurs, this thing you must have it very clear in mind. Once you vomit or something, the acid comes in your mouth, you will immediately want to go and brush your teeth. Please don't do that. Just wash it with normal water, wash your mouth with normal water, or if you have a fluoride mouth rinse, just use it. Please don't brush the teeth because the teeth are still soft. They are attacked by the acid just now. If you brush them, this mechanical force will erode them more. So just rinse it with mouth or use a fluoride mouth rinse, that will help. Also for aged patients, that's a solution. We have something called special care dentistry. We have something called mobile dental clinics. So if you're not able to come to the dental office, we can come to your home and we can do some simple treatment. Like we have a cement which releases fluoride and also very easy for us to do. So we can just mix that cement and place it over the tooth wear, which will help you relieve from your sensitivity as well as restore the cavity. So these things are some tips which we can do for even the aged people who are immobile. So I would like to end by saying, to give a disease-free and a functional smile means looking far beyond cavities. And we need to definitely understand how our teeth interact mechanically, chemically, and physically every day. Thank you.